Good morning. I am Francisco Chavez, and today I'm going to talk about safety and efficacy of bempedoic acid to reduce LDL cholesterol. Introduction. Bempedoic acid is a small molecule that has been shown to lower the LDL cholesterol level by inhibiting ATP citrate liase, a key enzyme in the cholesterol biosynthesis pathway that acts upstream of 3-hydroxy-3-methylglutaryl coenzyme A reductase, the target for statins.
What is cholesterol? Cholesterol is a fat-like substance that plays a vital role in every cell of your body because it's a building block for cells and hormones. The cholesterol you have in your body comes from your liver and your diet. It's important to understand that there are two types, LDL and HDL. The first type, LDL cholesterol, travels from the liver and the stomach into the gut, where it's absorbed into the bloodstream and travels to the body's tissues. When there's too much of this type of cholesterol in your bloodstream, it can build up, narrowing your arteries. This is why this type is sometimes known as bad cholesterol. When there is too much cholesterol in your bloodstream, it's known as having high cholesterol. This is a key risk factor in the development of heart disease. The second type, HDL cholesterol, also travels from your liver and stomach to the gut, where it's absorbed into the bloodstream. However, unlike bad LDL cholesterol, HDL is returned to the liver where it's broken down, which is why it's also known as good cholesterol.
Applications in medicine. Statins are drugs in primary care clinics to reduce cholesterol. When they don't work or are not powerful enough at high doses, they are combined with other drugs with a similar effect but with a different mechanism. Statins at high doses can cause muscle pain. Bempedoic acid, in the same way that statins are able to block essential enzymes in the human body, able to increase blood cholesterol levels and enhance the effects of the statin themselves. To reach this conclusion, more than 2,000 individuals were studied for more than a year. The way of acting of the new drug would imply that it is absorbed in the liver to become its active form, without ever passing to the muscle, thus avoiding the adverse effects that the statins can produce.
YouTube channel. Subscribe by clicking on that button down here.
1 in 4 Americans takes cholesterol-lowering drugs called statins. They work, but often cause painful side effects, primarily muscle pain. Jack Manley says he could barely walk when he was on the medication.
It was very discomforting, yeah, and it was constant leg cramps.
Now a new study in today's New England Journal of Medicine is reporting that an experimental medication called Bempedoic Acid, taken along with a statin, reduced cholesterol by 18%.
This medicine could help a lot of people. Many people can't take a high dose of a powerful statin. So particularly we use combinations, 2 medications, sometimes lower doses, to get the same effect.
Jack took the drug along with his low-dose statin as part of a clinical trial.
Woo, girl.
His cholesterol is now down nearly 100 points, and he says he's feeling better than ever.
I want to be able to enjoy my grandchildren, so it's very important.
The drug is now under FDA review and could be approved early next year. It's expected to cost $3,500 a year. Dr. John Torres, NBC News, New York.
Hey, NBC News fans, thanks for checking out our YouTube channels over here to watch the latest.
Pros and cons. Pros. Don't cause muscle pain, long-term effects. Cons. The price of the drug is not defined. They have not tested the adverse effects of the drug in people with different pathologies.
Not only do statin drugs lower LDL cholesterol, but more importantly, have been shown to substantially reduce the risk of having a heart attack or dying from heart disease. In fact, for every 10-point reduction in LDL cholesterol, there is an approximate 10% reduction in cardiovascular risk. Consequently, lowering LDL cholesterol with statin therapy remains the primary treatment in patients with dyslipidemia. Statins are well tolerated in most individuals, but as with any medication, there are side effects which may limit their use. The most common side effects associated with statin therapy include gastrointestinal intolerance, such as nausea or bloating, upper respiratory symptoms or headache, liver abnormalities, and muscle aching. And more recently, there's been an association reported between statin use and the development of diabetes and potentially memory loss, although a little less better substantiated. Now let's look at the more severe adverse events and look at how commonly they occur. Liver abnormalities, fortunately, occur in less than 1% of individuals who take statins, are usually transient and may go away if you stop the medication temporarily or even continue it at lower doses, and in addition, rarely leads to any type of liver dysfunction. Muscle symptoms, such as myalgia or muscle aching, occur in approximately 1.5 to 3.5% of individuals. Fortunately, myopathy, muscle injury, is very infrequent, occurring less than 0.1% of all individuals who take statins. Now, fortunately, these side effects are infrequent in patients, but there are still some individuals who the use of a medication which has been proven to be effective in reducing cardiovascular disease.
Issue applied in Ecuador. At the moment, it is unknown when the clinical use of bempedoic acid will be approved, but Esperion, the pharmaceutical company responsible for its manufacture, hopes that during 2020 it can be marketed. Conclusion. The discovery of the use of bempedoic acid in the reduction of cholesterol is a great advance to improve health, because it is safer and has fewer adverse effects compared with other drugs.
Number 8. Bempedoic acid for cholesterol lowering in statin intolerant patients.
Cholesterol is a major concern for nearly 40% of American adults. The fat-like substance is necessary for the body to function, but too much low-density LDL cholesterol can lead to buildup in the blood vessels, which can cause a heart attack or stroke. While several medications exist for treatment, statins are the most popular, but the prescription comes with some adverse side effects. Statin drugs enter muscles, causing muscle pain in approximately 5 to 10% of people who take them. A new agent, bempedoic acid, has been designed as a once-daily oral therapy, given in addition to a patient's current cholesterol medication regimen. Like statins, bempedoic acid works by blocking a key enzyme used by the body to make cholesterol. But unlike statins, it cannot accumulate in muscle, reducing the likelihood of muscle pain. In clinical trials of the therapy, patients saw their LDL levels drop by an average of about 25%. If approved by the FDA, bempedoic acid could be another addition to the arsenal of cholesterol-lowering treatments available to patients.
Thanks for your attention.